Pragati, this will be the exam spotter for your final exam. Today we will see regarding the dialyzer and what are all the expected questions you might get in your exam. So various type of dialyzer are kept. The most important parameter you have to check in the dialyzer wrapper is what are the important parameters you will see.
So the effective surface area.
You can show to the video.
The effective surface area. This is the surface area it is covering. The material it is made up of synthetic hollow fiber dialyzer it is.
Then important question here you might encounter is what is the other name for the dialyzer? What is the other name? It is also called as hollow fiber artificial kidney because it is a hollow, contains multiple fiber. So that is why it is doing half of the function of the kidney, mainly filtration and excretion function. So that is why it is called as hollow fiber artificial kidney. Okay. In the wrapper, nowhere you will get the details of single use or multiple use. Since the dialyzer parameter or the patient, as per the patient profile, we have to select the dialyzer surface area. So that is why for your residency, you have to focus on the surface area. And what is TMP?
Pressure it can withhold.
Transmembrane pressure. Okay. Now we will open this dialyzer. You can open this. So the examiner might give you the dialyzer in your hand, and what are all the parts or component of the dialyzer you know of?
So these two are the blood ports.
Okay, this is for blood entry.
This is for blood exit. These are the dialysate ports.
Okay.
In counter current, the dialyzer will enter from this port and will exit from this port. So this is the hollow.
Like for example, the blood always comes in this direction, enters and exits. The dialysate can come in this direction also, which is called co-current. If the dialysate fluid or the water, for your understanding, even if you take this will go in the opposite direction, is counter current. Okay.
So then, sir, inside there are micro capillaries also.
Micro capillaries.
Out of which the two mechanisms happen. One is the diffusion and one is the convection.
Primarily two mechanisms occurs, diffusion and convection.
Yes. And then there is a ring which is called the O-ring inside, which keeps the water or the dialysis.
Which holds the microcapillaries. All the microcapillaries are kept in position because of the O-ring.
O-ring. Yes.
And what is this you call? Header space.
Headers.
Yes. Header. And this material, what you will say?
Hollow tube.
This is the potting material. Housing material.
Housing
you can see. Potting material actually holds it. Housing material holds the entire dialyzer.
Yes.
Other question you might encounter is what are all the poisons which are being removed by the dialysis? Apart from that, what are the complications during dialysis? And how many times you can use the dialyzer? Ideally?
Ideally, one time it has to be used, but in India, due to financial issues, we can use a dialyzer to up to 3 to 4 times.
Okay. Will you open this dialyzer?
Yes.
This is 1.5 meter square. This is another dialyzer. You can show what is the surface area.
Yes, sir. 1.3 meter square.
So, and both are of Pro company.
Yes.
Pragati, will you tell what is the use of this color coding which is present in this dialyzer, which is not present in this dialyzer?
Yes, sir. So this dialyzer.
What is the use of this color coding?
Sir, to identify the entry port and the exit port for blood for the
Since
technician.
we are going to use it for multiple times, the technician who are using it might be different. So to have a universal color coding, red means blood entry, blue means venous side. That means blood is leaving from this side. And why there is no color code in this?
So this is a single-use dialyzer. Only one time we have to use and then we have to discard.
So that is why there is no color code. So this is single-use dialyzer. Ideally being used for hepatitis B, C and HIV positive patient. After the single use, you can discard this. And you know regarding fiber bundle volume? No. So these kind of question, once you answer all the preliminary question, probably the question will take to fiber bundle volume. I hope even if you answer your preliminary questions, at least for your spotter, that will be more than enough. So these are the dialyzer, various types. And apart from this, further differentiation can be done according to the force, flux, how much water it can remove. Those kind of parameters are there. Usually for a final year MD resident, they won't go into those topics. Only the parts and the complication, poisons, that will be more than enough.